Hi, this is Dr. Barron with High Point Spine and Joint Center. I wanted to make a quick video about your diagnosis of BPPV, telling you a little bit more about what it is, some of the treatment options we have in the clinic to help you, and some of the things that you can do on your own to help at home. So, BPPV stands for benign paroxysmal positional vertigo. It's the most common type of vertigo. It is something that can be mild to very intense and very debilitating. But the nice thing is that usually it's something that we can take care of, teaching you some things to do in the office that can help and things that you can do at home as well. It's more common in people who are around the age of 50 or older, and definitely more common in women than men. And it's characterized by these brief but very intense episodes of dizziness. And it's usually triggered by specific head postures or positions. People, when they tip their head up or down or to the side, or lying down in bed and rolling over, those are positions that can really trigger this BPPV vertigo and create some very intense dizziness. It can be accompanied by some nausea, and in severe cases, people will vomit with it as well. And it gives you this feeling of you're out of balance when you're standing up or walking. You have to hold on to a wall as you walk down the hall. I've had some people that crawl into the office with it because it is so intense and so severe. So it can be very debilitating. But what causes it is when you have these crystals, or what we call canaliths, in your ear, and they're in the wrong position. And so they can become dislodged in the inner ear, and these crystals, when you roll over quickly, they can float down into what we call a semicircular canal, which is it's the position sensing organ in our inner ear that when we tilt our head or we move our head, fluid changes some of the hair cells within that organ, and it causes our brain to know where we're at in space. But you get these little crystals in your ear that eventually can accumulate into that part of the ear where they're not supposed to be, and they create this piston in there that moves those hair sensors and those cells incorrectly and gives your brain bad information. And so really the goal of the treatment in the office is to try and position your head in such a way that we can get that clump or that piston of crystals out of the semicircular canal back down into what we call the vestibule of the inner ear. And that can help us where then once they're down into that part of the ear, you don't have the symptoms anymore. So we call it a canalith repositioning procedure. It's better known as a half somersault because that's kind of the position you get into. And it's basically these simple, slow maneuvers with the goal of moving that particle or those crystals out of the fluid-filled semicircular canal, out into the bag-like vestibule of your inner ear, where they no longer cause symptoms and where they can be more easily reabsorbed by the body. Usually those positions are held 15 to 30 seconds after some of your symptoms go away. And so our treatment in the office is really focused around teaching you that maneuver. The nice thing is once you know how to do that maneuver, it's something that you can do on your own at home if you have other episodes of the condition. So that's a little bit about what you have, and what we do is really teaching you to do that maneuver at home, and that's what you do to help treat yourself as well. So if you have any questions, please call or text our office. We're happy to answer questions about it at any time. I appreciate you listening, and we'll see you at your next appointment. Thanks.